Hi everybody and welcome to another edition of Seven Rivers Health. I'm Rick Teesey, your host. In today's program we're going to talk about some difficult decisions you might have to face, whether at home or at the hospital. We're talking about advanced directives and the importance of making those decisions before something occurs. Also, we'll talk about organ donation and how important it is for you to consider signing up and being an organ donor. Also, to lighten things up a little bit, we're going to talk about volunteerism. We'll talk to the Director of Volunteer Services at Franciscan Skemp about how you can volunteer at the hospital. But first, let's talk to Art Peak. He's a social worker at Franciscan Skemp Healthcare, and talk about the importance of advanced directives. Art Peak, thanks for joining us.
Good to be here.
Art, let's talk about something that is very difficult for many to talk about, and that is advanced directives. How important is it to talk about those?
Well, my role at Franciscan Skemp is a social worker, and one of my responsibilities is to talk with people about advanced care planning, and it's a very difficult subject, especially for people who are contemplating getting up in age and health issues come to pass, and they want to know how and what circumstances might arise as they pass away. And so it's quite important that we can try to eliminate a lot of those fears and assumptions, and allow families to have a kind of a peace of mind as they discuss those topics ahead of time, versus the time when, if something comes to a crisis, it's a lot different kind of conversation.
What exactly are advanced directives?
Advanced directives, advanced directive actually is kind of like an umbrella term. It really applies to a lot of different terminologies. Advanced directives means any document or direction that is done in advance. So for example, some of the older terminology used to be called living wills, declaration to physicians. Sometimes doctors would just dictate on a chart somebody's wishes pertaining to end-of-life decision-making, like CPR, no CPR. And so generally now the term advanced directives really applies more for the specific document that most people use, and that is a power of attorney for healthcare.
As a social worker, how do you kind of get people to start talking about these issues?
Well, these issues come to our attention in a number of ways. One, we try to do a lot of public education on this through various formats, through Franciscan Skemp and through the public and through other venues, as well as when we meet with patients who we get a referral from a physician. Physician may have a patient who has some interest in knowing more about advanced directives. The healthcare providers are actually required by law to inform the public that you have a right to complete an advanced directive. Whether you complete it or not is up to you, but we at least have that responsibility to inform the public. And so that is relayed down through, like I say, the physicians, other staff at the Franciscan Skemp Healthcare.
Do you start off with the attorney stuff? Do you start off with the living wills? Where do you kind of start?
Well, you know, the document, as we talked about, is called the Power of Attorney for Healthcare, and that document really is a combination of a number of formats over the years. Prior to 1991, the Patient Self-Determination Act, the document used to be called the living will, and since then it has evolved into incorporating other components, such as designating a power of attorney, or an agent, a healthcare agent, to be able to be appointed to make decisions if you are no longer able to make those decisions. And so basically that discussion and that concept is discussed with the family, and we try to give them some understanding of the document, and to be able to begin to let them be aware of the things that they need to think about.
And one of the key issues I think that needs to be discussed here is this puts the ownership of those decisions on the patients ahead of time, rather than making maybe the family members kind of come up with a decision. Correct?
That's correct. That's a good analysis of that. I am on the Systems Ethics Committee, and sometimes we meet with families because they have a loved one who has not made out some type of a directive, and who is in sort of a critical state of health care and end of life, and there's really nothing to go by, and it becomes a very emotional, very charged situation, especially when they have to make decisions regarding whether or not to keep life support on or off, and they want to know what would have mom really wanted to have done. And so, guilt and frustrations and trying to help resolve those situations are some of the issues that can be prevented if a document is done in advance.
And I think it gives a sense to the, as you said, the sense of the family members who are visiting the hospital and such, visiting mom or dad who are in those types of situations, that maybe just, they can maybe feel a little bit more at home with whatever the decision is. Kind of.
And, and a lot of these things, if the document is done right and the discussion is done with family members, a lot of that stuff is discussed in advance, so they're aware of the conditions that mom or dad or anybody could have, health issues that could leave or evolve into some type of a crisis in terms of life support. And so those are the, like I say, the primary issues of appointing a healthcare agent is to be able to have somebody in advance who is aware of what your wishes are. Because, some families have, for example, a mom may have 5 different children, and everyone has a different belief, different thought, different feeling pertaining to end-of-life decision-making. And everybody has a certain spiritual, base as well. And so sometimes it's good that we are in charge of our own health care versus somebody else who may not have our same values and beliefs.
One of the main reasons why I had you here is not only the importance of this, but also this is a major impact thing regarding healthcare reform, wasn't it, as well?
And I'm not fully aware of how the whole issue of the, quote, death panels came about. I know certain individuals are attributed to saying death panels in the healthcare reform bill, but when one thinks about the concepts of healthcare reform and advanced directives, these documents have actually been going on since the mid-'80s or earlier. Wisconsin's been very proactive in helping patients to make their wishes known, which then came about in 1991 with the Patient Self-Determination Act, which then, from then on, has allowed us to create documents. But I think the main issue in the healthcare reform was the fact that under that Reform Act, physicians were going to be able to be reimbursed like once every 5 years. I'm not exactly totally on that, but once every 5 years they have a discussion with a family member. Well, we have those discussions now, regardless of whether or not the physician gets reimbursed. And because of the fact that we receive Medicare, we are required by law to inform the public. And so that discussion happens anyway.
And here in the community, and you've seen it in the papers, you've seen it on TV, the fact that La Crosse, not only Franciscan Skemp, but Gunderson Lutheran as well, does a great job regarding this.
Yeah, I have been as far as in Utah and other places, and then people have been aware of the Cooley region area and its efforts to enlighten the public on advanced care planning, and this model has gone worldwide in terms of its exposure.
Quickly, when should I start talking about it? When should people at home start talking about this?
Well, historically, people start talking about it when they either get up in age or they feel like, well, I'm getting old now, so I should do it. And that really isn't the most appropriate time. I mean, any time is a good time to start. But these documents are really designed for anybody at the age of 18 and over. And so I have actually seen more and more people in their 30s and 20s have begun to realize the significance of doing these documents. And a lot of it comes from the fact that they now know an elderly aunt or a parent or who has died, and they themselves now feel it's time to start talking about these issues. And so any time is a good time, preferably younger, but like I say, historically, as we get more health crises, as we visit the doctors more often, we are often reminded that we should do these documents.
A tough conversation, but one that really should be had by all.
It should be done. Yep.
Art Peak, thank you very much for joining us.
Thank you.
We'll be back right after this.